Irfhan. It's Monday, it's 5 p.m. or just gone 5 p.m., which means we are in for another week of interesting, exciting, informative and entertaining guests, I hope, inshallah, here on Ramadan FM. How have you been? How has the first week of Ramadan gone for you? It's whizzed past. It really has. You know, the first week has just gone. In fact, we're coming to the end of the first third of Ramadan. So it is the 10th of Ramadan today, or the 9th, depending on when you started. It is Monday, the 11th of April. And this is Irfhan M. in the hot seat once again for your listening pleasure. And believe me, folks, it is a pleasure, privilege and honor to be able to sit here and bring these exciting programs to you each and every day. And Jazakumullah khair to everyone behind the scenes for their help, support and encouragement for getting this on the air as usual. So it's been a good week, a really good week for me. Bit cold though, could do with the weather heating up, and hopefully later on in the week we should be getting some warmer weather, inshallah. But listen, I want to hear from you guys, and today we've got a really important program, and I'll tell you about that in just a moment. But before I do that, I'm going to give you the numbers that you need to know, and if you don't know, then get to know. The number for the studio. Getting a bit of feedback here on the old headphones. The number for the studio is 0116 482 2086. It's 0116 if you're outside of Leicester. Send me a text or a WhatsApp on 077 488 055. A big hello and assalamu alaikum to all the online viewers, whether it's YouTube or Facebook, and you can check us out on TuneIn, the website, and smart speakers as well. So whatever you're doing, there is no excuse to miss Radio Ramadan 87.7 FM, broadcasting as always from the heart of Leicester City, the city of champions. Okay, folks, we got an exciting and important show today, important program, and I want to talk about why it's very important. So, Loros is a hospice that looks after patients from Leicester, Leicestershire, and Rutland. Just excuse me one second, Akil. I'm getting a lot of feedback on the line. Akil, can you hear me? No? Can you hear me, Akil? Getting a lot of feedback in the headphones. No? Is it okay? All right, I'll carry on then, no problem. Sorry about that, folks. You know, it's live radio. We have technical glitches. So we have talking about Loros today. Loros is a hospice which looks after patients in Leicester, Leicestershire and Rutland. And every year they care for about 2,500 people across the county, delivering the very best in high quality, compassionate end-of-life care and support to terminally ill patients, their families and carers. Most of all, this care is free. So Loros is a charity. It is funded in part by the NHS and by donations as well. Not to be confused with a care home, Loros is a hospice which provides, like I said, support, guidance, signposting for those who are coming towards the end of their life and giving respite to their families and loved ones. Some of the services that they do are short stay inpatient wards for symptom management for end-of-life care, outreach support in the patient's home. So, for example, nurse specialists and a home visiting service. They also do day therapies, complementary therapies, as well as counselling. And as I said before, patients are accepted from Leicester, Leicestershire and Rutland. Now, the reason why I wanted to talk about Loros today is you may remember a couple of years ago, they did come on the show. We had members of Loros coming on the show talking about a pioneering study at the time, which was called Thinking Ahead. And I'm delighted to say that joining us on the line this evening is Dr. Zoebia Islam. Assalamu alaikum, Zoebia. Do we have Zoebia on the line? 1 second. Assalamu alaikum, Zoebia. Can you hear me?
Assalamu alaikum, Irfhan.
Wa alaikum salam. How are you?
I'm good, thank you. Thank you so much for inviting me along today.
Oh, absolute pleasure. Listen, how is your Ramadan going so far?
It's going well, thank you. How is yours going?
Yeah, it's going so far so good. Starting to feel a little bit tired and a little bit cold, but actually the weight loss is helping me, so that's good. I need to lose a few pounds, and I'm all for that. But listen, thank you so much for joining us this evening. I know you have a very busy timetable, but I know that also that you wanted to talk about the Thinking Ahead study. So let's jump straight in. And if you can give our listeners a bit of a recap on what the study has been about and why the study came about.
Okay. So the study actually started in November 2019. And over the course of the last 3 years, we've actually spoken to 100 individuals, and that's included patients, their family carers, and healthcare professionals that are involved in their care, as well as individuals that have been recently bereaved, to understand their experiences. So the idea was to help doctors and nurses deliver care that's right for the individual and their family, especially when discussing very serious illness, when someone is so sick that doctors worry that they might die. And we found that can only be done by individuals sharing their thoughts and letting us know what would be helpful for them or not helpful for them. And what COVID has shown us is that many doctors and nurses are having to act as family members when death is approaching, because obviously some family members have not been able to be present when somebody's dying, especially within a hospital environment. And it's really important for doctors and nurses to understand about an individual's personal, cultural and religious beliefs and what's important to them and their loved ones, especially at this very sensitive time in all of their lives. So that's the main reason for the project.
Okay, so it sounds like this was a much needed piece of work, yes?
It is. It was a very much needed piece of work.
Okay, great. So the Thinking Ahead of study, so it started in 2019, and I'm just guessing that you've come to the end of the study itself.
Yes, we submitted the report to the funders at the end of last year. But one of the things that people have told us is that it was a key project. And we know this because people were so willing to give their time to us at a really sensitive period in their lives. And they talked to us really generously, gave their time to us, just to shape and show us about their experiences, what mattered to them when it comes to end-of-life care planning, what was important to them and their families. So what people were telling us, for instance, is that for some individuals, it was very different, it was very diverse. Everyone's an individual and their opinions are very diverse, and what matters to them is very diverse. So for some individuals, it was very much about having every possible treatment, but for others, it was about, actually, we don't want any treatment. We want to just stay at home, be at home with our families. But most people want information about their illness and what might lie ahead. But doctors and nurses understanding this is very important, because especially when individuals couldn't see their loved ones, and doctors and nurses were quite often having to act on the behalf of patients and family members. Okay,
thank you. So in terms of Loros, this is a service which I knew very little about myself and my family until we had to access and use the services for ourselves. And this was in the instance of my mother, who spent the last 8 days of her life using Loros services. And I have to tell you, Zoebia, using the service and actually experiencing not just the care that was being given, but the holistic elements of the care that wrapped around the service. For me personally, it has stuck with me ever since. And this is, I'm talking 9 years ago. And it's really changed my life. Why does there seem to be such a difference between the level of end-of-life care given in a hospice versus that given in a hospital setting, for example?
They are very different services. So quite often when you come into a hospital setting, you come in a crisis scenario. So when you're in a crisis scenario, it's very much treatment that's needed immediately. In a hospice setting, we may be able to tailor your care. And it's really important to have an end-of-life care discussion if you can. And that's what this project was about, really, is seeing if individuals were able to share their experiences, to actually tell us if they were able to have those really important end-of-life care planning discussions, because that can ultimately guide the care that you receive when it comes to when you're deteriorating and when you're dying. And as you've mentioned, your experiences with your mother were very positive, and I'm assuming you were able to have that discussion with the doctors and nurses in the hospice setting, which you may or may not have done if you were in a hospital setting, although that discussion should be available for everybody.
Yeah, absolutely. And it was that, I suppose, that level of personal care that really made the difference and was the most impactful, taking nothing away from the healthcare professionals in hospital settings. But just going back to the project itself, can you tell our listeners the level of expertise that you had involved in delivering the work?
So in terms of the team that were involved in the project, we were a team of experienced researchers, because some of us are doctors, some of us are nurses, but we also work really closely with members of the public, some of whom have been recently bereaved, like yourself, Irfhan. So it was really important to be guided by members of the public to ensure that the work that we're doing is essential for their needs and what they deemed as being important and significant. So it was a real collaborative project, if you like, between academics, doctors and nurses, and also members of the public as well.
Absolutely. So it sounds like all elements of, I suppose, the cross-section of society and the communities are needed in order to get that level of information and insight. But when we're talking about end-of-life care and dying specifically, I imagine it must be incredibly challenging to talk about that, especially with certain communities.
I mean, it's a sensitive topic, Irfhan, but the last 3 years have shown us just how important this work is, especially in a situation when you cannot see your loved ones. And the individuals that we spoke to have all told us how important this work was. And it is challenging. I think talking about death and dying is challenging in all different groups, but particularly in some groups that we did speak to. But what they did tell us is that they wanted to know more. They wanted to know about the services, such as what the hospice provides, what's available for them. And they needed to be more discussion, more of a dialogue, a conversation between the healthcare professionals and the communities that we serve in order to make that topic less of a taboo subject, if you like, Irfhan.
Mm-hmm. Okay, so folks, you're listening to Radio Ramadan 87.7 FM. I have with me Dr. Zoebia Islam on the phone. Dr. Zoebia is a research fellow at Lauros Hospice, and we are talking about the pioneering Thinking Ahead study and understanding the differences and experiences of end-of-life care for patients of a Black or ethnic minority background. Just give us a flavour of the main things that emerged from the study and what you found out. Okay.
So the key thing, I think, is that patients and their families want to be seen. So there's a Zulu greeting called Salbona, which literally means I see you. But it's about being seen, known and heard. So they want doctors to see them. They want doctors to know them and hear them. So it's about understanding somebody's culture, their religion and personal beliefs, and respecting those cultural, religious and personal beliefs. Now, trust is key, and trust was a key theme that came out of it. So in order for patients and their families to share what's important to them, what their preferences are, both medically and as an individual, and what their own values and beliefs are, it's really important to have that trust. And healthcare professionals need to be able to ask in a way that's appropriate and acceptable for that individual, that family, about what do I need to know about you to make your life and your death as good as it can be. So that's key. It's also about understanding that everybody is an individual, regardless of if they share the same faith or same ethnic background. So, for example, if somebody's had a particularly negative experience in the NHS in the past, that's ultimately going to have an impact on the way they choose to discuss their preferences with healthcare professionals in the future. It's going to have an impact on that trust. So it's about building that trust, having the right communication, Irfhan. It's really important to have interpreters in place, but also explaining things in a language that is accessible for patients and their families as well. So they're key things, I think.
Yeah, I mean, that's really important. You mentioned language and communication. Quite often in a hospital setting, for example, the patient can be there, but sometimes the healthcare professionals, they don't talk at the patient directly. They'll talk around or over the patient, or maybe talk about the patient in front of them to their loved ones.
Absolutely. I think a lot of the time it's because they haven't got interpreters present. A lot of the time the family members are being the interpreters for them. And quite often healthcare professionals don't really know the family dynamics within that. Who is the speaking on behalf of the patient, for example, but it's really important for the healthcare professional to gauge an understanding, provided the patient has capacity, of what the patient wants and needs. And that's something we've developed as part of this this Thinking Ahead project. Is we've developed a training resource for healthcare professionals, so that they're able to help doctors and nurses to be able to ask appropriate questions, to gain an understanding of family dynamics. I mean, what we actually did was, based on the stories, the experiences of the patients and families that we've spoken to, we've developed 8 stories. Now, these stories are fictionalised stories, but they're very much based on what the patients and families told us. They have to be fictionalised to protect anonymity and confidentiality of the patient and their families. But these stories are part of this resource, and anybody can utilise these stories. They're available on the Loros website, and you can access them along with a learning guide as well. But this resource is absolutely free. It's available for healthcare professionals online, and they can access this, and it can help them have those conversations in settings like you mentioned within the hospital or any sort of setting, and gives them tips and guidance on the best way to have such conversations in difficult scenarios.
Okay, folks, so check out www.loros.co.uk/thinking ahead to access the resources and the stories that Zoebia's just talked about and mentioned. If you have got a question for Zoebia or would like to make a contribution to the discussion today, why not drop me a WhatsApp on 077 48 855 055. It's really important to be talking about end-of-life care. It's not the easiest of subjects. I know, I understand, but it is really important to ensure that we as a Muslim community, first and foremost, are able to get the right care, the right non-clinical care, should I add, for our loved ones. Because especially as Zoebia has mentioned, during the time of COVID, we would like whoever is looking after our mums, dads, grandparents, whoever it might be, we would like them to have at least an understanding or an awareness of the needs and the requirements, especially when it comes to Islam, and dealing with a loved one who is coming to the end of their life. So drop me a text on 077 48 855 055. Like I said, delighted to have Dr. Zoebia Islam from Loros here with us. Just want to go back to the actual study itself, Zoebia, for a second. With this subject, I mean, what were the biggest challenges that you and the team faced in trying to extract that information or extract that experience from individuals or groups?
Okay, well, everyone's diverse. Everyone's got different views and opinions. I think it's really important to work with that family. A lot of people didn't understand what end-of-life care planning is, so they resort to talking about, oh, yes, I've talked about my funeral and what I want to happen after my death, but they didn't really understand about what is end-of-life care planning. Is it about, where at the place I want to die, for instance, the sort of treatment that I want to have. It could also be about the resuscitation decision, but there was this real lack of understanding about what end-of-life care planning was, and that they could have these discussions, which are called end-of-life care planning discussions, or they could have an advanced care plan in place where they'd be able to tell healthcare professionals about the sort of treatment that they would want to have, and around the decisions about resuscitation as well. So there's a real need, if you like, of collaborative working between healthcare professionals and the communities that we serve to make information, such as information about end-of-life care planning, but also about the hospice, because a lot of people don't understand what a hospice is. Mm-hmm. Some individuals have this misconception that it's a care home, it's a service that you have to pay for. But there needs to be some more collaborative working between healthcare professionals and the communities that we serve. And really, I would like to say that that's the next step forward. That was one of the key issues that we had, is that people don't necessarily know or understand about the services that are available and what they can access. So one of the things that people told us were about the positive aspects of care that they'd received. So, for instance, having a healthcare professional tell you what services they were entitled to. Say, for example, if they lost capacity, they were unable to go up the stairs, what adaptations could be made within the home. But unless the healthcare professional told them about that, they wouldn't know. The people don't know about what services are available for them. Does that make sense?
Absolutely. And, going back to the awareness and raising the profile of what hospices do. Like I said, I myself, I did not know. I knew that Loros was a hospice. I didn't necessarily know what they did. But do you feel, especially with the South Asian community, do you feel there is a reluctance or maybe even a guilt to access these services?
So there was some element of people talking about societal pressure, what I call societal pressure. So it's almost an element of they had to be seen to be doing everything they possibly could for their loved one. And if they didn't see that, they felt that they were being judged by the community. So if they were accessing, for example, a carer, it was almost like, oh, you're not doing your duty as a son or a daughter-in-law, for instance. So there was a bit of element of that, but that wasn't in all cases. And then people did tell us that those that had accessed services, for example, such as a carer, care services, a carer coming into their home, what a difference that had on their quality of life. And there was very little consideration on the actual carers themselves. So the carer's burden, if you like, people were having to take time off work to care for their loved one. And that was very heartwarming for us to hear how much care that people were able to deliver to their loved ones, but also the fact that they felt that they had to do that because of this societal pressure to be seen to be doing everything they possibly could for that loved one. So yes, there was a little element of that, Irfhan.
Okay, thank you very much, Zoebia. It is Ramadan Radio 87.7 FM. Time is coming up to 5:30. Folks, I've not had one text or comment yet on the WhatsApp, so please drop us a line on 077 488 55055. That number again is 077 488 55055. Really important subject, end-of-life care and how we can improve the experience and the cultural relevance around end-of-life care. And we have Dr. Zoebia Islam from Loros Research with us this evening. In terms of the study, again, Zoebia, as you were speaking to patients and the families, what did you learn about possible gaps or improvements that could be made to help improve end-of-life care? So
in terms of possible improvements, there needs to be more working, if you like, with healthcare professionals. Obviously, we've developed a training resource, but what we were able to do as part of the project was to disseminate some of the findings from the study. And we had these fantastic community workers who went about and talked about the findings from the project across the study sites, which were Leicester City, Leicestershire, Nottingham City and Nottinghamshire. And we spoke to they spoke to over 100 people. And these individuals actually told us they wanted to know more. The gaps in terms of the service, Irfhan, there needs to be more of a joint service. So what people were telling us is that quite often they're having to go to various consultations, and every time they go to these various consultations with doctors or nurses, they're having to repeat their case history. And that was a real fixation on behalf of people, constantly having to repeat their story again and over again. Why weren't doctors and nurses looking at their notes before? So it's almost like they wanted to have a one key worker, if you like, that would be able to be their key worker, that they could reiterate their story, to have a more joined-up service as opposed to such a disjointed service.
Okay, so that seems to be one of the strongest themes emerging from what you found. But just going back to the findings itself, and you talked about the learning resource that's going to be made available. Yeah. But in terms of the wider NHS, how will these findings be effectively utilized to ensure that the experience of care is more standardized across all settings?
So the resource is freely available for all NHS staff across the UK. So you can access that resource for free. It's on Health Education England, and they can access that resource. So that's one element of it. But this work's just the tip of the iceberg, I found. There's just so much more that needs to be done. Mm-hmm. And as I said, there needs to be this collaborative working between healthcare professionals and faith leaders, community leaders, individuals from the communities. So this is really a call for action, really, to faith leaders to work with hospice, for instance, to generate understanding of the services that are available, because it's a two-way thing, isn't it, really, that we need to have those conversations with individuals from the communities, and they need to be willing to have those conversations with us, and any information that we have going forward about the services that we provide needs to be available in a way that's accessible, appropriate, and also acceptable for individuals. And we can only do that by working with community groups and organisations. So that's, I think, the next step. What we need to do is some joint working to shape any resources or things going forward. So let's start having the conversations between community groups. And really, this is a call out to any of your listeners that are faith leaders or community or involved in any community groups or organisations to get in touch with me via Ramadan FM, and I'll be happy to start having that conversation with you.
Yes. Okay. So we know we have a very diverse listenership, and we know we have many community groups here in Leicester and Leicestershire. So anyone listening from whatever background, whether it's Indian, Pakistani, Bangladeshi, Somali, Arab, Turkish, please get in touch with us here at the Ramadan 87.7 FM, or contact Loros via their website and get in touch with Zoebia, because it is really important that we continue this dialogue. What I've seen with this study is that now that the study is finished, the work in essence is just begun. We've done all the work, the study has come up with the findings, but we now need to develop those relationships with those communities that sometimes don't naturally come forward to access help or have an understanding about what is out there and might need some guidance or some signposting. So community leaders and faith leaders, the imams, the ulama who are listening, please get in touch with Loros, because your contribution is really important. You probably might not understand how important it is, because people like yourselves, your leaders within the community, you have access and you can give permission to those communities to start talking about these subjects. And trust me, people, brothers and sisters, listeners, when you're in a situation when you're having to look after a loved one, it is absolutely stressful. It's so heartbreaking, but it does make a difference when you're speaking to people who know what they're doing and can actually help and support you during that journey. So please get in touch with here on Ramadan FM. The studio number is 482-2086, 01648222086. Still haven't got any questions or comments on the WhatsApp, so I'll give that number out again. It is 077-488-55055. A couple of more questions for you, Zoebia, before I let you go. And again, thank you so much for taking part in this program this evening. You've got the study, you've got the findings, we know what we're going to do with them. Is there any ways, or have you seen anything already that has started to make a difference as a result?
So as I say, we've got the resource, obviously, but this work is just the tip of the iceberg. We've started having discussions with community groups, and they're welcoming those discussions. They want to have more discussions. They want to know more about what a hospice is, the services that we provide. But as I say, this work's just the tip of the iceberg. I want to know, and we want to know as a hospice, is how can we make these discussions about death and dying more appropriate, more acceptable in terms of culture or religion. So again, that's a call out to your listeners. We also got a group that we have within the hospice. It's our own research consultees group, and these are members of the public, patients who are interested in research, and they come and share their ideas on and guide us really on any work that we're doing going forward. So again, another call out to listeners: if you've got an interest in research, please do get in touch. It's a voluntary group and anybody can join, and it's our public and patient research consultees group. So that's something that you might want to be involved with. There's so much more work that needs to be done, Irfhan. So we want to know what else doctors and nurses could be doing to support patients and their families when they're close to death. So I just want to share my own experience with you a little bit, my own lived experience.
Please do.
So, yeah, my granddad died in hospital in 2020, which was a really difficult time, as you know. It was the height of the pandemic, and you couldn't be with loved ones when they were unwell, and it was a very sudden illness. He was taken into hospital, and we didn't know that he was nearing death at all. But he died actually in hospital at that time, and it was very difficult for us to comprehend. But I remember when we went to the hospital and they told us about that the granddad had died, one of the things that we were comforted by, and myself was comforted by as a granddaughter, was the fact that the doctor present was able to recite the declaration of faith, the Shahada,
yes.
On behalf of my granddad. This is a Muslim doctor. It was completely by chance, Irfhan. You couldn't have planned it. It was just one of those things. He just happened to be the doctor with my granddad at the time. But one of the things that I would like to know, and I know my colleagues would like to know, is something that listeners would want is for doctors and nurses to perhaps recite the declaration of faith on behalf of patients who are unable to do so when they're dying. I'd love to hear their thoughts on your listeners, or perhaps they might want to ring in and let me know if this is something that is appropriate. Would they see this as something that is appropriate or unacceptable? For me and my family, was something that gave us great solace and comfort to know that that's somebody.
If you talk about the COVID pandemic, sometimes whether it's appropriate or not, there just might not be a choice, and you would want whoever is looking after your loved one at that time to at least have an awareness that this is a requirement of the Muslim faith at the time of death.
Absolutely. I'm happy to have discussions with community groups and organisations about this very subject, and I think it's a really important issue. I mean, it's impacted on myself and my own experience, but I'm sure it's something, as you say, that's impacted on a lot of people throughout the pandemic and still will be going forward in the future, because we have to remember that what happens at the end of someone's life is really important. And as you said, with your mum's experiences, it's that memory that lives with that family forever. So we need to help people have the best end of life and the best memories possible, don't we?
Absolutely. So, again, this study is already starting to make a difference, and we want people to still come forward. So, youngsters, if you're looking for a volunteering opportunity or you would like to get involved and learning more about this, maybe this is something you want to do as a career in terms of looking after people, do visit the Loros website, or do pop in and see what information is available about how you can be involved. So the study's come to an end now, Zoebia, and we've talked about, this is the beginning of the work, but in terms of the next steps, what is it that you and the team are looking to achieve next?
So in terms of the next step, it's very much about having a more of a collaborative approach with the communities that we serve. So working with communities to make services more acceptable and more appropriate. So really getting an understanding of what it is that individuals need and want. And that can only be done by having those discussions, but working with communities as well. So not just having researchers as a main focus, but perhaps developing community research, for example, to having those discussions. Because we found our community development workers were fantastic. They were individuals from within communities who were able to have those discussions, and they got some really important insights. And we can only get those insights by working together collaboratively, and I think that's the next way forward. And as you've already pointed out, there's so many opportunities within the hospice for individuals from the communities, whether they've got a vested interest in healthcare setting or want a career in research or whatever, to come forward and start having those discussions with us, perhaps joining our public and patient research consultees group.
Brilliant. So, folks, you heard it there. From Zoebia, get in touch, find out what it is that we need to do. And, it's really important, because one of the things that really winds me up, if I'm allowed to say, is that sometimes as communities, we feel that there isn't enough being done for us. But at the same time, when there is an opportunity for us to contribute, we don't take that either. So unless we're actually more proactive and more forthcoming with our experience, with our ideas and with our support, it's really difficult to make a change. Would you agree?
Absolutely. I think we do need to work together on this. And that's the only way we can make services more accessible, more appropriate for everybody, is by working together. If people don't tell us what they want, what they need, then we can't change the things going forward. So it's really important to have that conversation, have that dialogue. And perhaps this is the start of that conversation, Irfhan.
I hope so. I really do. Listen, Dr. Zoebia Islam, thank you so much for coming on today. Before I let you go, what is the message you would like to share with our listeners? And I suppose, is there a call to action?
So the call to action is, please get in touch. We're here to listen. We want to work together. We want to make services more accessible, more acceptable, more appropriate. But we can only do that by having that conversation and dialogue with you listeners.
Okay. Thank you so much for your time this evening, Dr. Zoebia Islam. Really grateful for your expertise and your insight. And I'd like to wish you a very sort of blessed remainder of Ramadan, and a very happy Eid with you and your loved ones. And please, please, please do come back again and tell us how this study is making a difference, maybe next year, inshallah.
I will do. And the same to you and your family, Irfhan.
Thank you so much. That was Dr. Zoebia Islam from Lauros Research, talking about thinking ahead, understanding and exploring the differences in end-of-life care for communities from different backgrounds and beliefs. Oh, the time is 5:40 on Monday, the 11th of April. It is Ramadan 87.7 FM. Folks, what did you think of that? Give me a call or drop me a text on 077 488 55055. If you are currently experiencing or looking after someone and you need some support and help, please, in the first instance, speak to your GP. You can be referred to Lauros if it is clinically appropriate, and your GP or hospital consultant or your hospital care team or your community nurse will be able to help and advise with that. Patients are usually eligible for referral if they are suffering from an advanced life-threatening disease or life-limiting condition, such as cancer, motor neuron disease, heart failure, or respiratory failure. So if you are in a situation and you're feeling a bit lost, or you need a bit of help and a bit of guidance, please get in touch with your GP and ask them to give you information and a referral for that. So we've got about 8 minutes left in the show, and that was Dr. Zoebia. And she was Dr. Zoebia Islam from Lauros. I just want to give you a quick update on tomorrow's program. We've got Asim the poet, who's going to be our guest tomorrow. So make sure you tune in for that. And he'll be talking about everything from his spiritual spoken word, amongst other things as well. So 5 p.m. tomorrow is Dr. It's not Dr. You've got Asim the poet. I've got doctors on my mind now. But listen, folks, that was really important to talk about, and I want to just spend a few minutes talking about end-of-life care. And I suppose I want to talk to the whole community and talk about us as a community around end-of-life care. And I want to give some personal experience and insight into this. When my mum was diagnosed with her condition, it was absolutely devastating, heartbreaking, as you can imagine. Do we have a call? Okay, I'll come back to that. Caller, yes, salaam alaikum.
Walaikum salam wa rahmatullahi wa barakatuh.
Okay.
Special one. How are you?
Oh, is this Mr. Baiji? Can you please stop calling me the special one, bro? Listen, assalamu alaikum. How are you doing, brother?
Alhamdulillah. How are you?
I'm good. And listen, what would you like to say to us?
I've been listening to your show. I was told to listen to it today.
Yes.
So I just wanted to say it's good to have you on it, and you can tell it's Ramadan whenever you come on. You can tell it's Ramadan.
Jazakallah khair. What did you think of today's subject?
Very, very interesting, and it's very, very good. And I think the important thing is here that I think people need to understand there's loads of services out there for Irfhan. Loads of services out there. I work for the local authority myself.
Yeah.
And the amount of services we have is incredible. But it's up to the individual to basically do the research and fight for the service.
So, Saj, can I ask you at this point, right? You make a really good point about the number of services out there, but how do we change the mindset of certain groups or certain elements within the community who sometimes just don't even want to acknowledge that these services are out there, or feel that these services have a lack of understanding in terms of their faith or their background?
The problem here is, I think people, just feel, I think it's fear. I think people think that, we've got to go for this service. We're not going to get this. We're not going to get that. But I think that the situation is very simple. You don't ask, you don't get. It's as simple as that.
But so you talk about fear, and this is the point I was about to make before you called in, is that what I've seen is sometimes, we feel judged as children, as sons in particular, and I'm talking about cultural elements and cultural forces here, not specifically religious ones. But sometimes we feel that there is a duty towards our parents to look after them. But in undertaking that duty, we sometimes for want of a better word, we martyr ourselves in the sense that, no, I have to do absolutely everything for my mum, my dad, or my loved one, because this is what my religion tells me. And if I don't do everything, then I'm a bad son, or I'm a bad daughter, or I'm a bad whatever it might be. And how do we get around that? Because sometimes, a helping hand makes such a difference. And we know this. I know this personally. My family knows this personally. And I want our community listening today to actually, just not feel scared about asking for help.
I completely agree, and I think it's not. It shouldn't just be about religion, and it shouldn't just be about culture. It's our moral duty, moral duty to look after our loved ones. And as I said, there's loads. If help is there, help's not going to come to you. You need to go. You need to go and look for it. And the way I look at it is, people need to take responsibility, and shouldn't be scared. There shouldn't be no barriers, because I don't care what anyone says. I know everyone's got views and opinions about this country and this, about the laws and about the politicians. But we are, alhamdulillah, so fortunate for the amount of services they have for everything. I mean, you tell me, Brother Irfhan, which country in the world would have a service to cut your nails? If you can't, the chiropodist. You tell me which countries provide services like that. 365 days a year, we have an ambulance service. The NHS is absolutely bombarded with COVID last year, but look at them now.
Mm-hmm. Mm-hmm. Yep. No, you're absolutely right. But listen, Sajid, how's your Ramadan going?
Alhamdulillah, it's amazing as always.
Yeah.
Can't complain, alhamdulillah.
And what's the last thing you'd like to say to our listeners?
All I want to say is, keep listening to the special one.
Keep listening. Listen. Honestly, guys, Sajid is not on my payroll or anything. If you think he's there to promote, but I really appreciate it, and it's always a pleasure speaking and listening to you. And thank you so much for your support, and please continue to support. And don't forget to tune in tomorrow. We got Asim the Poet. So Sajid, Jazakallah khair for your call today. Really good speaking with you, and have a good remainder of Ramadan, inshallah. I hope to catch up with you very soon.
Inshallah. Take care.
Take care, brother. Take care.
Allah Hafiz.
Allah Hafiz. That was Sajid, a very big supporter of Ramadan FM, and always great to speak with him. And thank you so much for your contribution. As I was saying, as part of that discussion, I would dearly love our community to come forward and start having some of these conversations and start having some of these. It is not easy, I know, but you're not alone. There is support out there. If any of you would like to speak to me personally, then if you've got my number, that's fine, not a problem, or get in touch with the radio station. I'm happy to talk to anyone who's going through a similar situation. Believe me, Loros changed my life, brothers and sisters. It really did. I can't tell you how much it meant to me, and I would. It's incredible, because the weirdest thing about Loros is there's a feeling of familiarity about them. Whenever you go to the hospice or whatever, it's like going to visit an old friend, and it's really weird, because that's a place where people are very seriously ill, and some of them are coming towards the end of their life. So it's kind of like this weird paradox going on. But listen, I've got a minute and a half left before I need to wrap up. But this is an important piece of work. The work is just starting. We need to hear from more community members. We need access into some of these communities to understand what's going around, so services can be developed and shaped around those individuals and those groups. So it's really, really important, folks. And I hope you enjoyed the discussion, as I did here, being in the hot seat, and we had some fantastic expertise on the line today. Right, guys, I've got less than a minute. We got Zainab coming up after 6 with her show, Breaking Stereotypes. Make sure you tune into that one. I don't know who she's got on today, but I'm sure it's going to be an absolute banger. So keep it locked on 87.7 FM. This is Ramadan Radio. I'm going to be back tomorrow with Asim the Poet. Yep, I've said it a million times now, but he's back tomorrow with me on the hot seat, and looking forward to that one. See, we're mixing it up here on Radio Ramadan. One minute we're talking about healthcare. The next minute we're talking about spoken word, and we've got a whole smorgasbord of subjects coming up between now and the end of Ramadan. And we've got about 3 weeks left of Ramadan, inshallah, if God wills. And it's going to be a great one. So whatever you're doing, folks, take care. Remember us in your du'as. It's been a pleasure as always.